As Brian Windhorst once said,
If 15 years covering the NBA has taught me anything, is that there's no such thing as a minor knee surgery.
Right.
And with today's report that Giannis Antetokounmpo recently underwent a knee cleanup procedure, I think it's an important time to address the truth about these seemingly benign surgeries. Welcome back, everybody. I'm Dr. Brian Sutterer, and my goal in this channel is to help teach you a little bit more about the medical side of the sports world. So if anatomy and that kind of thing interests you, then please consider subscribing to help support the channel. Shams reported earlier today that Giannis had underwent this cleanup procedure on his knee a couple of weeks ago and is uncertain for Greece's upcoming FIBA schedule. Hearing he had a knee cleanup isn't really helpful for what went on, and so if we go back to the original article where this reporting came from, we can learn a little bit more about what exactly the surgery was. This is translated from the Gazeta paper, I guess, that I'll link down below. And if we kind of scroll through the reporting here, we get a lot more key information. So sounds like Giannis was not really having any issue with his knee until mid-June. He had been training, participating in camp, no real concerns or issues, but then started to feel some minor discomfort in the left knee. I don't know if they meant to say this part about he's been familiar with it for years or if his knee has really hurt him for years. Of course, it's very normal for NBA players to have knee pain off and on, so can't really make too much of it. But clearly this got to a point where it was more intense and was really limiting him. So they investigated further, presumably got an MRI scan, which led to this arthroscopy. So an arthroscopy is the type of surgical approach when we hear about these cleanup procedures. It's the type of surgery where they go and make these tiny little incisions, put a camera through those little incision holes for the port access, and then use tools inside the knee to help treat the problem. If we scroll a little bit further, we really get to the meat of what happened though. So 15 days ago, Giannis made a quick trip to New York where he underwent the cleaning of his left kneecap, and then within 2 days, returned to Athens. If the reporting and the translating is correct here, what this means is that Giannis underwent a cleaning or a debridement procedure to treat the cartilage behind his kneecap, which matters if it truly was his kneecap because there's no meniscus behind the kneecap. When we look at our biodigital anatomy tool here, remember there's actually 3 compartments of the knee joint, and you can kind of think of them as 3 separate joints in a way. One of them is the patellofemoral joint. So it's actually the space behind the kneecap where the kneecap is sliding in the trochlea or the groove of the femur, and then you have the tibiofemoral compartments, a lateral and a medial. So 3 compartments of the knee, and there's cartilage in all of those compartments. There's actually extremely thick, in fact, I think it's the thickest cartilage in our body behind the kneecap because of all the force that our kneecap has to load and maintain when we're doing running and jumping sports. So whenever they go in and do these cleanup or debriding procedures, they'll look at all these 3 different compartments. They'll explore the cartilage in this tibiofemoral compartment. They'll look at the cartilage behind the kneecap. And presumably here, again, if the translating is correct, for Giannis, he had some deficits, some injuries, some damage to the cartilage behind his kneecap. And so that was the area that they cleaned up. We hear about these cleanup procedures a lot, and they often get kind of brushed aside, swept under the rug as no big deal. They'll be back in a few weeks, almost like it's a normal thing to have these cleanup procedures done on your knee. And it sounds very benign. It sounds very gentle and nice to go and clean the knee, almost like the knee is dirty. But the truth is these procedures can actually be fairly significant and tell us a lot about what's actually going on inside that athlete's knee and what might be coming down the road. Next, we'll dive into the specifics of that, but first I want to give a quick shout out to the sponsor of this video. This video is sponsored by Element. We're in the heat of the summer, and whether you're outside working out and exercising or just getting some stuff done around the house or the yard, you're going to be doing a lot of sweating. Whenever we sweat, our body loses key electrolytes, and these electrolytes are really crucial for the function of things like our muscles and our nerves. Element is an electrolyte drink mix that helps to replenish these electrolytes with a science-backed formula that features all the electrolytes your body needs without any of the extra garbage and added sugar that it doesn't. Each single serving packet of Element features 1,000 milligrams of sodium, 200 milligrams of potassium, and 60 milligrams of magnesium. There's no sugar, there's no gluten, and none of those dodgy, just sketchy ingredients you can't even pronounce like we find in a lot of typical sports drinks out on the market. It's also great that Element has the trust of professional athletes as the official hydration partner of Team USA Weightlifting. Right now, Element is offering my viewers a free sample pack with any purchase. That's 8 single serving packets free with any Element order. This deal is only available through my link, so go to drinklmnt.com/BrianMD to get yours today. So help support your electrolytes in a better way by ditching those sugary sports drinks and checking out Element today. Thank you again to Element for sponsoring today's video, and let's get back to our learning. Whenever we get MRI reports back or hear about athletes who had injuries in their knee or underwent these types of cleanup procedures, we'll often hear that the knee was structurally normal. And that can be confusing and a little bit deceptive because when we hear about a structurally normal knee, most of us, myself included as a doctor, will think that implies the ligaments are intact. The ACL, the MCL, the LCL, PCL, the tendons are intact. The structure supporting the knee is not torn or damaged in a way that requires specific treatment or something like a surgery. But remember that inside the knee, the joint is covered by cartilage. The meniscus, the little two cushion pads that sit inside the knee, are also made of cartilage. And whenever we get damage to this cartilage when we're older or from degeneration of that cartilage, we call it osteoarthritis. But when we're younger, we're playing sports, we're active for various reasons, you can develop almost little like cracks in the cartilage, what we call fissures. Maybe there's a small little area where there's little defects or potholes in the cartilage, and that can become symptomatic and cause pain and swelling, particularly in an active individual. So all those main ligaments can be totally normal, but if we look closer with an MRI or with a scope, we'll see little fraying, we'll see little cracks, we'll see little cartilage flaps loose, all these smaller little defects in the cartilage and in the meniscus. The challenge is determining how much of that is expected and normal versus how much of it is truly symptomatic and causing an issue. It's very common that an athlete has pain, say in the front of their knee. We get an MRI scan, and the MRI scan shows some cartilage thinning, some cartilage wear. Maybe they have pain on their joint line, and we get an MRI that shows some meniscus damage. And we have to piece together whether or not that's truly symptomatic or it's just an incidental finding. You might recall that Giannis actually missed some games earlier this season in the fall because of just nondescript left knee soreness, and that was this knee that was operated on. So it's very possible that the knee looked structurally the same back in the fall as it does now, but the symptoms maybe weren't to the point where they had to undergo a surgery. I'll also say the fact that Giannis didn't have to have anything addressed right at the end of the season tells me that the team didn't suspect there was a problem with his knee throughout the season that needed addressed afterwards, because if so, they would have done a surgery right away until waiting multiple weeks, months, until after the season was over to go in and address it. So this seems like a fairly quick, not necessarily reactionary type of treatment, but something that came up pretty quickly and then required fast treatment without necessarily an extended trial of a rehab period. Now, the reason I kind of call this a dirty truth is because the problem comes into play depending on how much you have to treat and how much you have to clean up within the knee. If we look back at our knee model here, of course, Giannis's reporting mentions that they treated the kneecap or the patella, which would be positive and hopefully imply that they didn't have to do anything to the meniscus. The meniscus is the cartilage pads that sit inside the knee, and the more you take out the meniscus, the more you shave it down, the more you distribute excess force throughout the knee and can lead to further problems down the road. Classically, Dwayne Wade talked about how he had a surgery to remove part of his meniscus when he was in college, and he thinks that led to a lot of his knee problems. If we look at the knee from the side here, of course, we've got the round condyle of the femur, and then we have it contacting the meniscus. This meniscus distributes the contact area across a wider span so that the force is more equally distributed. But whenever you start removing parts of the meniscus with these various cleanup, knee debridement, meniscectomy procedures, you can generate these basically hot spots throughout the knee where there's excess force going through the knee that can't be evenly distributed. And over time, that can lead to more force at a specific part of the knee, which can lead to further chances of things like arthritis. The little cartilage flaps that might get loose or sort of frayed behind the kneecap can almost be like a little hangnail back there and can certainly be symptomatic. But the more you cut away that hangnail and the more of that cartilage you take away, the more you're removing the body's ability to protect the underlying bone and evenly distribute the load. We've seen plenty of other players who have kind of gone down this path of having these repeat knee arthroscopy procedures, these repeat stories where we hear in the summer about somebody undergoing another knee scope to clean up or clean out the knee, and we kind of just disregard it. We assume it's just part of normal basketball, but what we have to remember is every time they go in there to do something, they are removing tissue, they are removing cartilage, they are removing meniscus potentially, and the more of those procedures you do, the more you affect the body's natural ability to protect itself and be a healthy joint. Now, the challenge, of course, is that sometimes you might not have another option. You might have tried everything conservative. The player's worth tens of millions of dollars. They need to get back out on there in the court. And so you have that discussion with them and you undergo a procedure that's going to allow them to play through the next couple of seasons and hopefully push off any issues further down. There are clearly times where you're in a situation like Lonzo Ball recently where maybe you have a big focal area of cartilage injury that needs a specific cartilage transplant or a specific treatment. But the more I hear about these guys undergoing these knee cleanouts, these knee debridements, this idea that it's okay and normal to go in and just take a shaver and shave down cartilage and shave out parts of the meniscus and acting like it's no big deal is, I don't think, the right way to think about it. I think you have to realize that you are potentially taking short-term gain to sacrifice long-term problems, especially if they are repeatedly done time and time again. I will say in the world of sports medicine, we've gotten away from doing them as frequently, but in high-level athletes, where you need to get back out on the court, get back out on the field, we often still see it because there is that push to get rid of that hangnail, cut that hangnail away so that you can get back out there on the court and continue playing. My hope with Giannis is that this doesn't just become a pattern. My hope is that they were able to take out such a small amount that it's not going to lead to any biomechanical changes in his joint or in the way that forces and tissues are loaded through the joint. We heard that it was just to treat the kneecap, but you never know when you actually get in there with the scope if you see a big meniscal flap or something with the meniscus that might cause irritation in 3-4 months, you might go ahead and treat that while you're in there. So we don't really know how much tissue they have to take out when they do these and how altered the knee is after undergoing these cleanup procedures. Like I said, all this is part of professional sports. It's not to say that this is bad medical care, but I think fans, teams, players need to realize that these aren't perfectly benign, completely harmless procedures. The more tissue you take, the more you affect the knee, and you very well can start this slippery slope where you take a little bit, and next time you have to take a little bit more, and the next time you're taking a lot more, and then before you know it, you end up in a situation like some of these guys, like maybe Alonzo Ball or Brandon Roy historically, where the knee just structurally doesn't have the same amount of protective tissue as before, and you really do end up having more issues. So I think we need to stop calling these cleanup procedures because there's really nothing clean about it. It's kind of an unfortunate thing that we sometimes have to do, and in reality can have implications down the road, and is something that I think we all just need to be a little bit more educated about. That's it for the video, everybody. Let me know as always any questions or comments down below, and until next time, we'll see you later. Bye.